Hello, and thank you for joining me for the 12th video on the series of staying healthy and preventing COVID 19 infection during the current pandemic. Hope you have able to follow some of those instructions we discussed over the previous 11 videos. So, COVID 19 can infect anyone, that nobody is immune to get infected. Some people don't get bad infection or the clinical symptomatology because they do have a strong immunity. Yet they too can get infected and carry the virus and infect others. Irrespective of the age, sex, or ethnicity, everyone is vulnerable to this disease. Up to now, the incidence was mostly in the elderly people above the age of 70, and the death rates were much higher getting once one is getting older. In part, it's due to comorbidities like lung and heart disease, and mostly due to weaker immune system. However, in recent days, it seems to be also attacking younger people, otherwise healthy. In fact, the youngest had been reported recently was a 4 months old infant. So, irrespective whether you are healthy or not healthy, you can still get the disease, but the outcome depends on how strong your immunity status is. So, because it's a changing situation, one should not consider anymore that COVID-19 is exclusively disease affecting the elderly, which is not true. Although the mortality rates are highest in the elderly, younger people do get the disease and some dies. And the death rate varies tremendously from the country to country. For example, younger people in like South Korea, the death rate is about 0.1%, whereas in Europe it's approaching 1%. So it's a tenfold difference can be due to a number of reasons. In addition, younger people can also be a carrier of the disease and transmit to others, especially to the elderly and their parents and grandparents, for example. So let's summarize again for the benefits of people who may not have listened to all 11 videos, to necessary steps to take to curtail the disease spread. So these are the bare minimum essential steps. So to minimize the risk of developing COVID-19, it is essential to have the following. Apply a rapid test to the diagnosis and extend the testing to the community. The wider the testing is available, it will be easier to catch people with infected or disease early enough before they spread the disease. Smaller the number of tests done, higher the problems to come in later dates. And it's going to be very difficult to control when the secondary infection occur in the community and in the hospital itself. So diagnosis early by testing is the number one way to prevent the disease. Similarly, the second is also the testing the large number of exposed and quarantined people, of course in a human isolation, is essential, as well as testing everyone in the quarantine situation before they leave the center. Community-based tracking is essential to identify the contacts and tracing them, and keep the map of GIS-based maps to trace their location and the spread of the disease. All are important, together with the effective country-wide reporting system. So this goes together with the real-time surveillance and the exposed, and identify the exposed and new patient in the community level. So the next one is actually the one discussed in the previous video, the boosting the community immunity level by exposing them to the sunshine, advising them, and providing them with vitamin D capsules to boost their immune system very quickly. As I said before in the previous video, if you give 600,000 international units one capsule, within 24 to 48 hours, the immune system is kicked up and the chances of getting the virus is reduced by 1/3. It's a huge effect. So in addition to the boosting the immunity level, it's also important to improve the nutrition state of the community as well as reducing anxiety. So this goes completely against the current approach by some countries by putting 24-hour curfews and not providing information or explanation doing that. So this will add not only the anxiety but also cause nutrition imbalance in weeks to come. And then another key factors not done by some, whereas like some of the Eastern countries doing very well, is the informing the public on the real situation on a daily basis, so that the public knows what's going on and they can take additional precautions themselves to protect themselves and their families. Then once a vaccine or drugs are available, to use them promptly and efficiently and most cost effectively, especially in those who are in the intensive care units, to save their lives. This has to be go hand in hand with the dynamic effective disease prevention guidance on a community level and prevent the public getting panic by all means. Government should not create a situation for them to get panic in addition to the tensions and the stress they're already having. In addition, encourage the people to engage in the good personal hygiene, hand washing, and use of face masks always when they get out of home for whatever the reason. And totally avoid the crowded places and do not release too early the premature release of these social distancing guidelines. So the question quite often asked is whether we do develop immunity against coronaviruses. Those with a high immunity by nature, because of genetics and good diet and having vitamin D, has a strong immune system and have the capacity to fight against the coronavirus easily. And also, they are the ones who quickly develop antibodies against the virus and eliminate the viruses from their bodies. So overall, having a good nutrition and strong immune system is very helpful to not only survive, but also prevent any complication from this disease. When there are such people, larger number of such people in the community, they will also help to develop a herd immunity so that entire communities can be protected from this magic word is a herd immunity, so that protection of the larger percentage of people in the community. The immunity generated through the antibodies generated against the COVID-19 generally is expected to last a year. However, it will be only effective against the current local strain of COVID-19 virus. So that's a tricky thing, because there are already something like 8 different strains that have been identified. One antibody developed against one strain may not protect against the other. Therefore, at least in theory, somebody who got over with the coronavirus indeed can reinfect through a different strain of coronavirus. Unlikely, but it's a possibility. Therefore, reinfection is a possibility, but it's not a likelihood at present. So the next video addresses the out-of-box ideas to control COVID-19 and longer-term research and innovation needs to prepare for the next epidemic or the pandemic. Be prepared. This is Professor Sunil Wimalawansa, Professor of Medicine and Nutrition at the New Jersey, United States of America. Stay safe. Thank you.